Well, greetings everyone and welcome to our International Nurses Day webinar today. It's great seeing where you're all coming from in the chat, and I come to you from Darkinjung country on the central coast of New South Wales, Australia. My name's Deborah Toms and I'm the Eastern Asia Pacific representative on the International Council of Nurses board. This is an important day for nurses worldwide, and it's a day when we take a little time to recognise and reflect on all the great work that nurses do. It's a day that we can celebrate among ourselves, but also use it to promote our profession and highlight the work that still needs to be done to value, protect, support and invest in nurses. The theme for International Nurses Day this year is Empowered Nurses Save Lives. And in today's presentations, we will hear some great examples of how this happens around the world. Just some housekeeping. If you can use the chat for any questions, and the team will attempt to answer them online. There is no interpretation for today's presentations. So the first thing that we will hear from, or the first person we will hear from, is our president, Jose, who will bring us his message for International Nurses Day.
Hello, dear colleagues, dear friends. It's a great honor to welcome you all this special International Nurses Day webinar. Let me begin by thanking our national nursing associations for their leadership and for bringing us together today, and to each of you joining from wherever you are in the world. Today, we come together as one global nursing family. On this International Nurses Day, I want to extend my deepest congratulations and gratitude to the world's 30 million nurses for your commitment, for your leadership, for your passion, and for the care you provide every single day. In every country, in every city, nurses are making a difference, saving lives, supporting communities, and strengthening health systems. You are the backbone of care and the heart of health. This year's theme, Our Nurses, Our Future, Empower Nurses Save Lives, is both a celebration and a call to action. It recognizes a simple truth. When nurses are empowered, health improves, systems are stronger, and societies thrive. This message is at the center of our International Nursing Day report this year. The evidence is clear. Nursing power is real, it's measurable, and it's transformative. As the largest and most trusted part of the health workforce, nurses are closest the people and communities. You are uniquely positioned to deliver the person-centered, accessible, and high-quality care that the world urgently needs. But we must also be honest about the challenges we face. Across the world, nurses are working under extraordinary pressure, facing workforce shortages, increased demand, limited resources, and too often unsafe or unfair working conditions. And in many parts of the world, nurses are delivering care in situations of conflict and crisis. Through our campaign Nurses for Peace initiative, ICN is calling for peace, for the protection of health workers and health facilities, and for respect for international humanitarian law. Nurses are witnesses to the human cause of conflict and also powerful advocates for peace. Your voice matters in calling for dialogue, dignity, and the protection of life. Without urgent action, we will not achieve universal health coverage or the Sustainable Development Goals. This is why my presidential watchword is empowerment, because empowering and empowered nurses are not optional but essential. Empowerment means safe and fair working conditions. It means the ability to practice to the full extent of your education and skills. It means having a strong voice in leadership and decision making at every level. And it also means something more. It means that we, as nurses, must raise our collective voice. We must advocate. We must speak to governments, to policymakers, and to the society. We must ensure that nursing is valued, protected, respected, and invested in. Because we are not only caregivers, we are leaders, we are innovators, and we are change makers. And together, our voice is powerful. Investing in nursing is not a cost, it's a high return investment that saves lives, strengthens health systems, and supports economic and social development. So today, as we celebrate International Nurses Day, let us also recommit to supporting one another, to strengthening our profession, and to using our voice not only for health, but for humanity and for peace. Thank you for everything you do, and I wish you all a very happy International Nurses Day. Thank you very much.
That was great to hear from our president, Jose. I'd now like to introduce David Stewart. David will be known to some of you. He's the Director of Nursing and Health Policy Team at the International Council of Nurses, and he'll share with us some more about the 7 powers.
G'day everyone, and let me add my welcome to Deb Toms. And it's a great day, and wishing everybody a happy International Nurses Day today. This is a report that we've released this year, and I've had the pleasure of co-authoring this with Gillian Moore, who comes in Portugal, who lives in Portugal. And we focused in particular about the 7 powers of nursing. And when we talk about empowerment, we are not talking about making nurses work harder. What we're actually talking about is when the system is actually supportive, it enables nurses to deliver at their full impact. We recognise that there are enormous challenges in the world today. We recognise the growing burden of non-communicable diseases. This is the major cause of death globally. In addition to that, we recognise that a large proportion of the population do not have access to essential health services, and we have a rapidly ageing population around the world. And this is having a significant impact. In fact, poor health probably costs the global economy around 15% of GDP. And this is all happening at a time where we've got a large level of misinformation and mistrust in the health system, and it's having some profound public health impacts, including the reduction of immunisation rates around the world. But it's also happening at a time where there is significant humanitarian displacement or people in need. We're at some of the highest levels of displaced populations since World War II. And if we start to look at some of this, we look at, well, we really need nurses to be addressing health, some of these great, big, enormous health challenges. And as it's already been mentioned, there is 30 million nurses around the world today that are addressing healthcare needs. But this is about a shortfall of about 6 million nurses globally. And some of the challenges that we have is that we're struggling to keep many of the nurses that we do have. In fact, about 50% of nurses regularly think about quitting. And some of them as a result of just their experiences within the work environment, including 1 in 3 frontline nurses saying that they've witnessed patients die due to staffing shortages, or having an impact of violence in the workplace, which is exceptionally significant. So what we are seeing is this increasing demand for work with a decreasing supply of healthcare workers. And so what we were trying to do in this report is provide you a clear understanding of some of the core elements and skills that nurses bring to the health system, and how that through investment we can actually optimize these core components. When you look at the report, we also try and make it human as well. And I've had the privilege of engaging with many nurses across the world and being able to tell and share their story. But I want to quickly run through those 7 powers. The first one for me, which is absolutely critical, is the power of trust. For approximately 21 years, nurses have held the #1 ranked profession in the world in relation to trust. And this isn't just limited to one particular country. This is actually a global phenomenon. And trust is actually one of the most important aspects in the health system, because it means that people will provide an analysis of their symptoms and their information. And in fact, just by spending time with patients, we know that adherence rates for medications significantly improve. And of course, vaccination rates dramatically improve when they had the discussion with trusted healthcare professionals. This is a great photo. This is a photo of Brian. He's a home care nurse within the United States. And this picture, I think, tells such an amazing story, because it underpins, I think, what some of the trust is about. And you can see it in the way that he looks at the patient. He looks at the patient and sees them not as a disease or an illness, but as a person requiring care that is valued. And it doesn't matter how people come into our health services, what they may look like, their economic status, their religious status. As nurses, we continue to provide amazing care. In addition, the power of the professional. With increasing complexity of healthcare, with increasing technology, there is an importance that we have that scientific and the arts component of nursing to meet the healthcare needs of our populations. But it is more than this. It is also making sure that we have the ethical foundations to actually appropriately practice. And evidence is really clear that for every 10% increase in bachelor degree prepared nurses in hospitals, reduces patient deaths by about 7%. The power of numbers. The power of numbers is about capacity and coverage. When there is insufficient workforce, it means that people are either not able to access care, or we need to ration care, or it may be delays to treatment, or many other core components. But if we were able to scale the workforce to what is needed, we could potentially save around 190 million years of life lost. But we could actually add to the global economy by about 1.1 trillion US dollars as well to the global economy. To do that, we also want to make sure that people are working to their full scope of practice. We recognize that much care is delivered by nurses and continues to be done so. But many nurses are not using their full scope of practice. And about 80% of nurses say that they are overqualified for the work that they're doing. And so we must make use of this human capital to make sure that we can deliver on the health services that are required. The power of care. Nurses are unique in the sense that they have provided, or were one of the first healthcare professionals to provide people-centered care. to not just treat that illness, but to actually understand where people are born, live, work, play, and ultimately also pass away, to understand how to connect the health system together. And this is critically important as we address big things like non-communicable diseases or chronic diseases. And by 2030, if we could improve people-centered care, we could save over 60 million lives. But also, nurses are generally the people that are closest in providing care to their patients. Nurses spend more time than any other health professionals with patients. It is estimated that during a one patient day, a nurse will spend about 3.6 hours of their time with a medical patient. And so this has an enormous benefit, not just within the hospital setting, but sometimes nurses are the only healthcare providers that can be reached within the community. And then lastly, the power of peace. In 2025, it was estimated that there was over 3,500 attacks on healthcare facilities in last year. But in addition to that, there was over 2,000 healthcare professionals that lost their life due to violent attacks. You know, this is a core issue for health, and not just that there's in providing care in a conflict region, but these fragile states are often kept vulnerable for many years to come. And in fact, globally, it has an impact because 80% of major infectious disease outbreaks occur in fragile or conflict-affected countries. So you're going to hear some of the stories about different regions now and how they are looking or implementing some of these 7 powers. So thank you so much for your time today and being able to share some of the report today on International Nurses Day. Over to you, Deb.
Thanks, David. And it's great to get that overview of the report. And I recommend that you all have a look at that report on the ICN website and see what it might be able to do to enable you or empower you to do more. So now as David indicated, we're going to hear about a bit more in detail about some work that some have been able to do in terms of each of the powers. And the first power is Power One Trust. And we're going to hear from Giancarlo Torres, the President of the Philippines. This is a video presentation. Gian was unable to join us in person today. So we will now turn to his video.
Good day. Happy International Nurses Day. I am Nurse Giancarlo Torres, the National President of the Philippine Nurses Association. And for today, I'm given the task to share about the power of trust. For generations, the Filipino nurses has been a constant presence in an ever-changing world. From rural clinics here at home to the largest and the most advanced hospitals across the globe, we have built a legacy that defined by one single word, trust. Today, we must ask ourselves not just how we earned it, but what we intend to do with it. Filipino nurses are trusted globally, not just for their technical competence, but for the unique culture of caring, rooted in the word malasakit and the desire for kaginhawaan para sa kanyang kapwa. They treat patients not as a mere cases, but as human beings deserving compassion and dignity. Whenever they go, wherever they go, the Filipino nurses bring a kind of care that transcends language and geography. Patient always remember the nurse who stayed a little longer, smiled through exhaustion, and listened when no one else had the time. Ultimately, the trust is all about the presence. Being present, standing beside the patient in moments of fear and vulnerability. Being a present, becoming a source of hope, reassurance, and healing. And being a presence, creating an atmosphere of calm and safety. In a fast-paced healthcare environment, the Filipino nurse reminds the world that healing is not only a scientific, but it is a deeply relational context. The trust nurses receive goes beyond the professional recognition. It has a measurable impact. It motivates nurses to persevere through challenges and directly contribute to better health outcomes. When patients trust their nurses, Communication and compliance improve. When patients trust their nurses, anxiety and fear decrease. Recovery becomes more effective. Trust empowers patients to cooperate, gives families hope, and encourages communities to be proactive about their health. It strengthens the entire healthcare experience, allowing nurses to serve to the vital bridge between medicine and humanity. Technology may diagnose and medicine may cure, but the trust helps heal. That is the silent yet powerful contribution of nursing. However, trust is not permanent. It must be continuously earned, protected, and nurtured. So the important question before us today is, what are we going to do to keep the trust? First, we keep trust through continuous excellence. Healthcare continues to evolve rapidly. New diseases emerge, technologies advance, and patients' needs become more complex. Filipino nurses must therefore remain committed to lifelong learning, evidence-based practice, and even professional advancement. Competence sustains confidence. Second, we keep trusts by taking care of the nurses themselves. We cannot pour on an empty cup. Supporting nurses through safe working environments, promoting mental health programs, fair opportunities, and professional recognition ensures that they can continue delivering quality care with compassion and excellence. We do this by ultimately reaching to the grassroots, listening to their concerns, visiting them through our kamustahan sessions. No matter how advanced healthcare becomes, compassion must remain at the center of nursing. The Filipino heart in nursing must never be lost. We keep trust by also bringing healthcare services closer to the people. Trust grows stronger when people feel that healthcare is accessible, responsive, and connected to their everyday lives. Filipino nurses do not only serve inside the hospitals, they serve in barangays, schools, rural health units, evacuation centers, and communities where healthcare is most needed. By reaching out to the most vulnerable populations, conducting health education, promoting preventive care, and ensuring that no community is left behind, nurses become the instruments not only as treatment, but of inclusion, social justice. When healthcare reaches the people, trust deepens. Now, let's take a moment to think and ask the question, how do we build upon this trust? We need to therefore amplify our voices, fuel our passion. How do we build upon this trust that Filipino nurses have earned globally? We build upon it by transforming trust into action. We are calling upon our partners in the International Council of Nurses. Let us amplify the voice of the Filipino nurses and nurses around the world. We call on governments, healthcare institutions, policymakers, educators, and other stakeholders to work collaboratively in promoting nurses' welfare, advancing nursing practice, and strengthening professional development opportunities. Because when the nurses are empowered, patients benefit. When nurses are protected, healthcare system becomes stronger. And when advanced practice nursing is supported, patient and health outcomes improve significantly. This is not only about recognizing nurses for their sacrifice. It is about investing on the nurses as leaders, investing on nurses as innovators, advocates, and partners in building healthcare societies. The trusts placed upon nurses must become the foundation for stronger policies, greater collaboration, and meaningful reform for our healthcare. Together, let us not just honor the trust earned by the nurses, let us invest in it. For when we empower the nurse, we heal the world. Thank you very much for this opportunity, and mabuhay.
Some powerful messages there from Gian on the first power of the seven, trust. We're now going to turn to the second power, professional. And Megumi Yamura Toshima is going to speak to us about this. Megumi is the second Vice President at the International Council of Nurses and also a Global Strategic Advisor to the Japanese Nursing Association. I'll now hand over to Megumi.
I'm delighted to celebrate International Nursing Day 2026 from Japan. I am Megumi Yamura Teshima, Second Vice President of the International Council of Nurses and Vice President of Tokyo Healthcare University. Today, I would like to share how Nurses Day is celebrated in Japan, and I would like to speak specifically about the power of professional within the theme. The seventh power, empowered nurse saves lives. First, the Japanese Nursing Association designated that week, including May 12th, as a nursing week, and hold various events nationwide. This year, to convey the appeal of nursing, the younger generation, posters were created that reflect their future images. In Tokyo, a talk event was held featuring a dialogue between an actor and JNA President Dr. Akiyama, as well as an award ceremony for nursing-related stories submitted by the general public. I am very pleased that the event was conveyed in the TV news and that the value of nursing was conveyed to so many people. Furthermore, this year, so the highly symbolic event for nurses in Japan, NHK Public TV in Japan has been airing that morning drama, Kaze Kaoru, Sense of Wind, for 6 months. This drama describes the late 1800s Meiji era in Japan, social structure and culture, women. I understand that the producer conceived the project after being deeply moved by the dedication of nurses working tirelessly during the COVID-19 pandemic. So the producer developed this drama, nursing story. Chika Ozeki, heroine the drama, established that the principle that nursing is a profession necessary for society and it requires education and training. Currently, many hospitalized patients in Japan are watching this drama while they are eating breakfast because it starts at 8 a.m. Isn't this interesting? I found deeply significant this fact that this nursing is being portrayed in a nation watched by over 17 million people in Japan. Efforts to convey the appeal of nursing to the next generation are also continuing at the healthcare institutions nationwide in Japan. As one example, I would like to introduce Kanazawa University Hospital one-day nursing experience. Last year, 20 high school students participated in this program. They received their official appointment from the hospital president and the director of nursing, and then they experienced patient care alongside with nurses. The participating high school student remarked, it was really to see caring, and it made me want to become a nurse even more. In the end of the program, they have a concert together. And patient also remarked, I felt that the power of music and everyone's love. It gave me the will to live ahead of my surgery the day after tomorrow. Along that moment, I received that those comments were from the patient. Nursing is not merely about providing medical care. It is an endeavor to stand by people, support their hope, and sustain their will to live. A fact I have been reminded once again. Here, I would like to touch on the power of professional. According to ICN new definition of nursing, a professional was defined as this way. Specifies knowledge and skills, standards of conduct, and regulation regulated by society, and the practice of applying these for the benefit of others, an example of the ICN new definition of nursing. The IND had three pillars of professional power: rigorous education, binding ethical standard, and regulation and accountability. In 2019, I have served as committee member involved in the revision of ICN Code of Ethics. At the same time, I had also involved in revising the Japanese Nursing Association Code of Ethics. As a society changed, what we nurse valued and what serves at the foundation of the practice, the Code of Ethics served as a compass for this. Code of Ethics is a compass. We review and adapt at the time. There are things that remain unchanged. That is, nursing exists to protect people's dignity, right, and well-being. I would like to make this today's takeaway message. Thank you for your attention. Thank you.
Thank you, Megumi.
Thank you.
And I think many of us would love to have a program that was reaching 70 million people and giving them an understanding of what a professional nurse is and the important role that they play. That's fabulous. And goes there, I say, to Power 3, which is about numbers. And for this one, we're going to hear from distinguished Professor Patsy Yates, who's the Executive Dean of the Faculty of Health at the Queensland University of Technology and co-director for QUT's Centre for Healthcare Transformation. Patsy has also had leading roles with the International Society of Nurses in Cancer Care and with Palliative Care Australia. Thank you, Patsy.
Thank you, Deb. And it is just wonderful to be part of this such important celebration. And I'm going to talk about numbers and about care, two which might seem to be contrasting, but in fact the 7 powers which we're talking about today really all are interrelated and they're very complementary. But I think David's comments earlier where he talked about if we simply had a workforce that was really, the opportunities were realised that it was up to its full strength, that we could save 190 million lives and that we could save $1.1 trillion for the global community. I really commend you taking some time to read this report because the numbers that are presented in this report are really powerful and they provide us as nurses, they will empower us as nurses in many, many ways to use that data for advocacy and for support. So I'm going to use an example in terms of the power of numbers, just to give one example of some experience we had in Queensland, Australia, with implementing safe staffing policies. And I've used this example because this is a great example of where the numbers speak for themselves, and they have been very helpful in terms of our advocacy efforts to ensure safe staffing in our state in Australia. So we did a project, and I acknowledge Linda Aitken from the US and Matthew McHugh who worked with us on the evaluation of a new policy that was introduced in Queensland, Australia, at a statewide level, which was implementing nurse-patient ratios. And we did a baseline and we did a follow-up assessment. So this slide is simply showing at baseline the variation in a relatively well-resourced health system in Queensland, the variation that existed prior to implementing our ratios across different services in Queensland. And you'll see that the ratios were ranged from over 1 to 11 down to closer to 1 to 2, 1 to 3 in medical surgical patients. And this is in a relatively well-resourced country. So we knew we had a problem. We knew that this variation must in fact be impacting on the quality of care and the outcomes of that care. So what we did was we implemented ratios. The government introduced a policy. And when we evaluated that difference, that variation, what we found was that for each additional patient per medical surgical nurse, it was associated with 12% higher likelihood of death in the facility. And for each additional patient per medical surgical nurse, it was associated with a 2% longer length of stay. Now, that's extraordinary. That's before we started. So every patient extra that the nurse had resulted in increased likelihood of death and a 2% longer length of stay. But we were able to do more than that with this data and with the numbers. What we were able to look at prior to and following the implementation, so we had a period of time where we let the policy be implemented, but we evaluated it later on and we found that staffing improvements, adhering to the legislated nurse-patient ratios, it meant that we were able to demonstrate staffing improvements for every 1 patient per nurse produced reductions in mortality, reduction in readmissions, and reduction in length of stay. And we were able to estimate what that meant in terms of costs by actually showing that by avoiding those fewer readmissions and having shorter length of stay, that was more than twice the cost of the additional nurse staffing that the ratios required. So the argument that this would cost the system really didn't make sense, because actually the costs that were saved by investing in those additional nurses indicated that that was well worth it. And importantly, the hospitals in the intervention, because we compared it with those who didn't have ratios implemented, was estimated to have avoided 145 more deaths, 255 readmissions, and a total of nearly 30,000 additional hospital days. So the numbers, as we said, the power of numbers, this speaks for itself. This was a statewide study. We had, tens of thousands of nurses, and we linked data with the health system to show that a simple intervention, one that was not that costly to the system, returned in so many ways from mortality. What I haven't shown you here too is all the data which showed us that it actually created a much more positive work environment for nurses as well. So the take-home message in terms of numbers, and numbers could be looked at in so many ways, but the take-home, we are the largest workforce. We know that workforce, the data tells us that we have challenges to workforce around the world. And if we don't really address that, then we're not actually going to achieve the best health outcomes for our community. And that workforce also needs to be resilient and needs to be supported. And safe staffing is just one example of where the data across the world in many, many countries now is repeatedly showing that it has important outcomes that need to be implemented. So I'm now going to just talk about the power of care. So that's about the numbers and the data, and workforce more broadly. But I had the privilege of being the president of the International Society of Nurses in Cancer Care for 4 years, so working globally. And one of the things about cancer, of course, is it affects nearly everyone, whether you have the diagnosis yourself or whether you know of someone or whether someone in your family. So cancer is one of those non-communicable diseases that is present everywhere and in growing burden, particularly in our region of the world, in the Wipro region. But one of the things that we know about cancer nurses is that, again, the data tells us that we are so well placed because of our presence, because of our holistic approach, because of our comprehensive ability to respond not just to the disease, but to respond to the way in which that disease impacts people physically, emotionally, and impacts their families. We are so well placed. That power that we have makes such a difference. So as president of the International Society, we developed a position statement where we looked at all the evidence around the scope of what nurses did in cancer care. And we found that nurses actually act right across that continuum. So they act in terms of increasing adherence to guidelines. They act in terms of counselling patients on access to systems and decreasing delay, which might improve their outcomes. And they act in terms of educating health workers. They're really important, particularly in low and middle income countries, important support for health workers. So just simply educating the public. Prevention. Nurses are also really very critical in many parts of the world in implementing preventive interventions at both the individual and community level. And they're very, very good, we found the data tells us, in many countries around identifying risk factors and communicating and teaching individuals and communities. Nurses also work at the screening and early detection part, where we are able to perform a range of interventions that contribute to screening, early detection, and even the prevention of precancerous lesions in terms of things like vaccinations, etc. these days. Treatment, of course, nurses are critical at the treatment phase, and in particular our power there is our ability to undertake that holistic assessment to keep patients safe by identifying adverse effects and really intervening early with the steps that might actually otherwise avoid complications, or perhaps in some instances these effects can be life-threatening, and nurses are often the people who prevent those from happening. Palliative care, nurses across the world are really at the front line of delivering palliative care. We're with patients all of the time and in across many different settings of care. And what that means for those whose cancers are not curable is that support that we provide them, but that holistic support, physical, psychological, spiritual, and culturally, for the person, their families, and communities, is quite unique, and really it represents the what everyone in our communities should have access to. Survivorship. So for those who undergo treatment and actually do live long lives, having survived their cancer. We're also, importantly, helping people deal with those long-term consequences by providing that psychosocial support, that education. And, of course, we're very important in that role of generating new evidence and contributing to both the medical trials of new cancer treatments, but also generating important evidence about that supportive care, which is so critical. So in this position statement, we outlined that we really needed to invest more in terms of the nurses' role across the spectrum, across the globe. Because the data, again, when we looked at what the data tells us, is that cancer nurses, when they are working and they're educated and they're supported to deliver their role, there is improved symptom management and quality of life. Patients are safer and they have reduced complications. We know that there's a great deal of growing body of evidence in some countries around the effectiveness of nurse-led care that actually ensures that people access the right services at the right time. But importantly, that last point, nurses are great at navigating and managing complex systems. Receiving a diagnosis of cancer puts one into a system where they need to access many different services. In low and middle income countries, it means that we need people who are going to navigate them to the right services to ensure that they're diagnosed as early as possible, that they receive the best possible care. Plenty of data which highlights that if we do this, then patients with cancer achieve all of these better outcomes. So again, my take-home message, and this is just taken from the report which David has presented to us today, is that nurses are key to person-centred care, preventive and primary care, and essential to bringing health to all and addressing the burden of non-communicable diseases. And they've got just by saying that scaling up that primary healthcare in particular could save 60 million lives by 2030. That's just a few years away in low and middle income countries in particular. So I think we've got a lot of work to do, but we know that the data is there, that the power of nurses in terms of our numbers, the power in terms of the care that we provide to keep patients safe, to improve their quality of life, to ensure that they get to the right services, it's there, the evidence is there. We just need to ensure that we invest in these areas to improve outcomes. Thank you so much for the opportunity to present today.
Thank you, Patsy. And that was some great examples of both the power of numbers and the power of care that nurses have within their grasp. I will now move to power 6, proximity, and Akisi Ravono, is going to speak to us on this. Akisi is a prominent Indigenous Fijian nursing academic researcher and is an associate professor and former head of the nursing department at the University of Fiji. So welcome, Akisi.
Yeah, thank you, Deb. Thank you for the opportunity to be able to speak today to the celebration of the ICN-International Nurses Day 2026, and focusing on the proximity of nursing care from Fiji. What I will do today is to just give a brief outline of the what is happening in Fiji in terms of delivering nursing care to the people out there, particularly focusing on people who are out there in the communities. Fiji, in brief, for those of us who have never been to Fiji, we have less than 1 million people, and we are rated 156th place in the world. And the current nurse population in Fiji is about a little bit more than 2,000. Or 2,100. And what we are experiencing in Fiji is gross shortage of nurses in the workforce. And we go through a lot of recent staffing changes, and we have tried to change the shifts from the normal 8 hours of shift to 12 hours to try and accommodate these challenges that we face in the workforce. And there is also a gross shortage of midwives. But however, the Ministry of Health has got some retention challenges because we are losing a lot of our nurses to countries like Australia and New Zealand. We continue to face a lot of challenges in terms of the workforce issues. Yeah, and what is happening in Fiji this week is we have our own individual celebrations going on in our respective workspaces. We have like say, for example, the Western Health Services, where I'm at the moment. There is an online meeting that's going on for the whole of today from Singatoka to Rakiraki. So they have something similar to what we are having or going on right now with the ICN. And also here at the University of Fiji, we have just come out from a celebration. We had a 3-hour celebration, and we were very lucky to have speakers from the past, nurses who have graduated in the 1950s and are still here with us. And we were so lucky that we were able to have them to come and talk to us. People who studied, the nurses who had studied in the 60s, and we were so lucky to have them to come and present to us their nursing journey. And we also had some presentations from the students who presented to us their experiences, what they went through, especially when they were working with the people who are out there in the communities. So as you all know, and it's a global crisis at the moment, Fiji is having a surge in its HIV, and that is where the discussion is going on right now with us here in Fiji. And as we celebrate Nurses Day, we are also mindful of the fact that our HIV statistics is rising, and it will continue to rise. Even though we have a lot of other challenges that we have at the moment. Now for the power of the proximity, when we talk about the power of proximity in nursing, we talk about how nurses go out of their own way to try and accommodate, to try and take care of the issues that are out there, particularly in the communities, and what they are going through, or what they are challenged with. And there are lots and lots of other things that the nurses are going through at the moment. So what we have done here in Fiji is we try and take our services to the rural areas where they are at the moment. Sorry, my slides are just playing up, and yeah, so I hope I'm there. Yeah. And so we take our services out to the community where people are able to access nursing care when we have nurses who come out to the community to try and deliver the nursing care right there at their doorsteps. So there are some communities that are very hard to reach, and nurses, they go on horseback like what we have in the picture at the moment. We also have nurses who have to cross streams and rivers. There are nurses who have to go on the small fiber boats to try and reach another island to be able to get to where they are, to be able to reach the community. So the Ministry of Health and the nursing fraternity in Fiji, we have developed some kind of strategies to ensure proximity in nursing care, and they include the involvement of healthcare workers in their own respective communities. We have got some healthcare workers who work, who deliver some data to the zone nurses, and the zone nurses, they deliver this information, they put it in their report, and all the important findings from that are then taken on for discussions. And we also have challenges from people who are in the maritime areas and the medical teams, like where I am at the moment. We have the Lotoka and the Yasawa team. They move out to the islands, and they go and collect data. They go and see the patients. So they take nursing services right to where the people are, and reaching out to the communities instead of the communities coming out to the healthcare facilities, because things are expensive and people might not be able to travel in time to be able to seek professional and to get assistance into their healthcare needs. We also have some home-based care support system in place where the nurses, like the nurse that is there on that horseback, travel to where the patients are and see the patients right there for themselves. So instead of waiting around for patients to come to our doorstep, we take the services out there to the people for them to be able to access healthcare services, particularly nursing services. We also have got our preventative and decentralized care programs where we decentralize the services that we deliver to the people so that everybody get to have some kind of access to healthcare, and particularly nursing care, because there are the nurses are the ones that are there in the zones, in the health centers, in the nursing stations all the time, unlike the doctors and other medical health professionals who are not all there all the time with the patients. So that's what is happening here in Fiji. We also try and strengthen some local facilities by the involvement of non-governmental organizations. We ask our donor agencies, and we have been very fortunate to be receiving some gifts, we can say, to be able to help nurses deliver nursing care to the people that we care for or we support. Yeah. So that is the presentation from Fiji. As Some of the take-home messages we can say is we have tried to build resilience to the challenges that we have or we continue to face as we speak. And we also try and ensure patient safety through other supportive care that we have. So we encourage the healthcare workers who are out there, these are community health workers, to assist nurses in each community. So each community would have a healthcare worker who would also be reporting to the zone nurses or to the community health nurses to be able to support nursing services. And we also try and invest. The main key or take-home message for nursing in Fiji is to invest in nursing to be able to curb the workforce challenges that we are currently facing. Yeah, and thank you again for the opportunity to speak here. And over to you, Deb. Naka.
Thank you, Akisi. And I think, it's very challenging in a country like Fiji where you've got quite widespread geography with oceans in between islands, trying to get services and ensure that they are near where the people are so that they are delivered in proximity. We'll now move to Power 7 Peace, and we're going to see a video from a senior nurse, Nurse April, in Myanmar, and then we might have some time for a quick chat at the end of that because Nurse April is able to also be online and we'll be able to hear her. So if we can go to the video from Nurse April, thank you.
Hello, my name is April and I'm speaking as a nursing lead for the Phoenix Nursing Program supporting nursing education in Myanmar. I want to speak today about the power of peace from a very practical perspective, what it truly means when nurses work across the time zones and borders to continue education, protect services, and the care for the communities in a context of instability, insecurity, and loss. After the military coup in 2021 and the civil war that followed, nursing education in Myanmar was severely disrupted. Many students found that their normal university routes were suddenly closed. Nurse educators and clinicians were displaced, forced into hiding, or found it impossible to work safely within normal systems. Our health system collapsed around us and our world became a very dark place. Yet, even as the fighting worsened, the needs of our people did not disappear. Children's Day became unwell, Mother's Day needed care, and thousands injured in the war required our expertise. We realized that while the junta could try to stop our work, they could not stop our calling. But even in the darkest places, there is always light. Often that light is held by nurses. We found education could help us to be stronger. Our Phoenix nursing degree was born. It is a unique partnership between Myanmar nurse educators, clinicians, students, and international colleagues like Marcus, including Royal College of Nursing and International Academy. While we have international support, the leadership and daily struggle come from Myanmar nurses who understand the realities on the ground. We built a 3-year degree aligned with the Myanmar nursing curriculum and the International Council of Nurses guidance, designed specifically for a conflict zone. This meant reinventing how we teach. We moved to flexible reported learning and low bandwidth resources to accommodate students with poor internet or those in hiding. We integrated clinical skills and supervised practice where safe, ensuring that students facing displacement or security threats could still progress. This effort is not just about academic credit. It is about protecting the future of healthcare. When nurses continue to learn and teach, they keep standards alive and strengthen public confidence. They remind our communities that the future has not been abandoned. We have seen incredible resilience. Our first cohort of 21 undergraduate students and 20 diploma to degree bridging students have now graduated. To reach this point, the program delivered 63 modules, 2,100 hours of recorded teaching, and 1,500 hours of supervised clinical practice. Today, More than 100 father students remain enrolled, studying in a few quiet hours available to them, often in dangerous circumstances. This program has helped us hold on to our professional identity and help students see that their future has not been taken away from them. However, we cannot lower our expectations. Our community deserves skilled nurses, and our students deserve a qualification that is credible and respected globally. The challenge is to remain realistic about our context without ever giving up on the quality. As we look into the future, we focus on sustainability. We need continuous support for our educators who carry an immense emotional and physical burden. We need investment in digital learning, translation, and safe practice placements. But above all, we need a return to democracy and safety. We need partnerships that are not just reactive but stay with us for the long term. For me, the key takeaway for our region is peace is not the only absence of conflict. Peace is the ability of a mother to access care for her child. Peace is the ability of a student to learn without fear. Peace is the ability of a nurse who lead with dignity, knowledge, and professional purpose. Nursing education is a fundamental part of that peace. It protects services today and prepares a workforce that will lead our recovery tomorrow. In Myanmar, we have proven that education and leadership can continue in the most difficult conditions. But this work should not depend on courage alone. It needs solidarity, investment, and global recognition. We need the world to understand that when nurses are supported to lead, they keep the light of hope alive, even when it's very dark. Thank you very much.
Thank you, April, and what a powerful presentation that was, and a demonstration of that continued commitment nurses have to their own education, to growing that next workforce, but also to ensuring their communities continue to receive care under the most difficult of circumstances. Just wonder, April, if we could take a few moments and if you could just share a little bit more about the challenges of delivering care in such a difficult and challenging environment.
Hello, Deborah.
Hi.
Hope you can hear me.
Yes,
Hi.
I can hear you.
Thank you for this opportunity, and thank you having this chance to talk about the challenges what we face and the resilience what we have. So the challenges are immense, and what you need to keep us going is the people who trust us, the people who rely to us, because they can't really go to those junta control hospitals, and nurses living with them in their communities, so they come and seek for help. Then you can't really ignore them. Even you're running away from your own life, you have to be with them. The constant target you are facing doesn't stop you who you are as a nurse, because fundamentally nurses, you need to take care of the people who rely on you. So every single moment, every minute, our nurses are facing these life challenges, yet they are brave enough to take care of the people despite all of these circumstances. And that's what keeps us going. And more, the other important thing is the international support, the colleagues around the world who have been with us since the very beginning. Without them, I don't think we are here today. So this is the power of nursing. When we all come together as a nursing family, that is something what we could achieve education-wise, or the care we're providing. So the solidarity is really important to me. Thank you very much.
Thank you, April, for sharing that. And thank you for having the courage to come and talk to us online here today and to share the experience and the challenges in Myanmar. And I think it just highlights the importance of that, as you said, how nursing can come together as one international family, but also to support nurses like yourselves in the many areas of conflict around the world, and the work of the Nurses for Peace program that the International Council of Nurses has as well. So thank you once again, much appreciated on this important day. We'll now turn to Michelle Gunn, who is another member of the team at ICN. She's the head of nursing practice and regulation, and she's going to talk to us about Invest for Impact. Michelle.
Thank you, Deb. And thank you so much, April. That was actually really inspiring. I'll just share my slides, if you can just bear with me just one little moment. But just while I do that, if I just sort of say it is remarkable the challenges that nurses face worldwide, but no more so in areas that are seeking peace. So firstly, thank you very much for having me here today. What I want to do is build on what we've already heard about the powers of nursing. And I want to start by saying that these powers that nurses have are actually real. They're not fictitious powers, they're real. Nursing has the trust of the community. We have numbers, we have the proximity to people and communities, and we're present right across the health system with the ethical trust and the presence. But again, power is not enough on its own, and power has to be invested to enable it and to lead. And today I really want to make 3 points. The one is that nursing is not a cost centre, it is a strategic investment. That 2, that nursing leadership is absolutely essential and we must invest in it. And thirdly, that we've got a new ICN definition of nursing, and this gives us a mandate that can help us actually make a stronger investment argument. So if we sort of start with the first, too often nursing is viewed through a narrow lens of expenditure. We hear about salaries, staffing, numbers, rosters and budgets. And while those things do matter, nursing, when it's looked at through that lens, is seen as a cost to be controlled. And we miss the bigger picture of what's happening here, what the potential is. Investing in nursing improves access to care. It strengthens prevention, it strengthens primary health care. It reduces avoidable complications, unnecessary admissions, fragmentation of care. It improves safety, quality, continuity. It helps people manage healthcare better, chronic diseases, recover from illnesses, manage at home better. It puts humanity back into a service delivery system. However, when nurses are under-resourced or prevented from working to their full scope, the system pays the price somewhere. It pays through delays, duplications, hospital pressure, burnout, preventable harm, and poorer outcomes. And as David has alluded to in the report, collectively across the system, up to 1.1 million is paid or lost to the system collectively. So the investment argument is not about asking just for more nurses, although nursing numbers matter. It's about us using, and the system using, nursing potential strategically. It means investing in education, regulation, legislation, and making sure legislation is enabling, safe staffing, decent working conditions so nurses don't become burnt out. It's about investing in digital tools that work and make nursing lives easier, not harder. It's about advanced practice and full scope of practice, but it's also about investing in our nurses so that they can also provide basic cares to the standards that they want and in a compassionate and dignified way. It means moving beyond task-based thinking and recognising nursing capability and enabling nursing to redesign the systems around them. The second point about nursing leadership. If nursing is to be able to live up to these powers or deliver the full return on this investment, nurses must not only be present in the system, but they must be where the decisions are being made. Nurses understand how policy plays out in practice. They see what happens when discharge planning fails, when prevention is underfunded, when workforce models are unrealistic, or where services are designed around institutions rather than people. And this perspective is really strategic intelligence, which we need to optimize so that we can change the status quo, so that we can move into those areas that we need to move into to make the changes that are needed. To do this, we need nursing leaders to be in the right roles. We need them to have the right authority, education, preparation, and support. We need to give them the opportunity to succeed, but also support them if they fail, so that they can fail and then go on to succeed, because that's an important part of how we do actually succeed. It means investing in nursing leadership pathways and programs such as the GLNI, but others globally. It means preparing nurses to lead clinically at the front line, but also in policy, regulation, service design, workforce planning, digital transformation, education, research, and reform. It means also addressing gender inequality, investing in women's leadership, and recognising that these are essential parts to strengthening our health systems globally. Finally, and before I close, I really want to draw everyone's attention to our new definition of nursing, which was launched in Helsinki mid last year. This definition of nursing is really empowering. It describes nursing as a profession grounded in science and ethics, human rights, professional judgment, and people-centred care. And that matters to the investment case and us attracting more investment, because when nursing is seen in a limited way, and sometimes through maybe a list of tasks, it can be fragmented, substituted, or undervalued. But when nursing is understood as a profession with its own knowledge, judgment, and accountability, then investment in nursing becomes investment in health system capability. The ICN definition explains why nursing has the mandate to do this work, but investment is needed to actually enable this and to enable nurses to work to their full potential and, in a sense, release the power that nursing has to the communities that we seek to serve. I want to wish everyone a really happy International Nursing Day and encourage you to continue to work to your full potential and empower yourselves, but also those around you to be able to deliver the standard of care and the mandate that we have to our community. Thank you.
Thank you, Michelle. So that draws to a close our speakers today. And it was suggested I might just share a small story with you all myself, that often I think nurses don't feel that we can ever get on to the global stage in some of the large organisations like the World Health Organisation, World Health Assembly. In my role when I was the Australian Government Chief Nursing and Midwifery Officer, I was regularly a part of the World Health Assembly delegation from Australia, and a number of my chief nurse colleagues from around the world were similarly there from their countries. In addition, I had the privilege of representing Australia on the executive board of the World Health Organisation. This was an enormous privilege, and to be able to be there as a chief nurse, and particularly in the year when the International Year of the Nurse and Midwife was approved by the board, to be able to speak as a chief nurse and second that motion was an enormous privilege. In addition, I was also able to move forward on a resolution from Australia about the eradication of cervical cancer around the world. This is somewhere where nurses can play a leading role. It is through immunisation, vaccination, and this is something where nurses around the world are often leaders. And to be able to be part of that push within the World Health Organisation was a tremendous privilege. So we can be at the very top tables of healthcare and bring our nursing knowledge and understanding of health systems and healthcare delivery to those tables. We've heard today a lot about the work of how the 7 powers of nursing, as outlined in the International Nurses Day report from ICN, can help us, can enable and empower nurses to save lives. We've seen that the importance of trust in that delivery of care and enabling us in that area. But it's not permanent, as was pointed out to us. We need to continue to nurture it, to continue to grow in our practice. The importance of profession and spreading that understanding of the profession and all that nurses can do, and the use of art through media to spread that message so that we can enable and empower nurses to take an even stronger place in healthcare. The importance of numbers, the role of safe staffing, good research, good data, and a very evidence-based decision process to drive change and ensure that you have safe staffing to enable better healthcare. And the example of cancer care and how nurses can lead that care and have a role in education, prevention, and screening, not just in strict healthcare hands-on delivery. We heard about proximity and the challenges of delivering care in rural and more remote settings and the important role of nurses in that, and the importance of providing ways to have resilience for these nurses so that they can continue in those challenging environments. And we heard very much a very powerful presentation about the delivery of healthcare and the continuance of educating nurses and building a workforce in the most difficult of conflict situations. And that the important line there, that peace is not only the absence of conflict, there's more to it than that, and that the important role nurses play in that. And lastly, from Michelle, about that important role and that nursing is not just a cost centre, it is an investment. It's an investment in healthcare. If you invest in nursing in an appropriate way, you will not only improve safety of healthcare, but you will save dollars in your health systems as well. So, and the use of the definition of nursing, the new ICN definition of nursing, to enable everyone to do that. So I commend today's presentations to all of you. I really encourage you to look at the report. There's a lot more detail and a lot more thought and ideas in the report that you can use within your own settings. I hope you all have a wonderful International Nurses Day, and I hope that you've taken home some inspirational thoughts and messages and ways of looking at how you can continue to grow the profession, your own practice, and improve the safety of care across the globe. Thank you.